What's up, you guys? It's your girl Breathe the Diva, and I'm back with another video. So today's video, we're going to be talking about the top 9 challenges that we face in sterile processing field. If you haven't already, please go ahead to subscribe to my channel and hit that notification bell so you can alerted the next time I upload a video. So y'all, let's just get right into the video. Alright, you guys, so we're going to go into the first one, y'all. And as you can see, I got my SPD Tech shirt on. Go get y'all some merch from Amazon, y'all. I got this from Amazon. So we're just going to start with the first one. I do got my paper here. So the top 9 challenges sterile processing department faces. So we're going to start off with 1. So number 1, y'all, is staffing issues. And I'm going to read a little bit and then I'm going to emphasize on it. So the shortages or insufficient training opportunities for current employees. Staffing presents a significant challenge for SPD. While crises such as technician shortages lead to staff burnout and delays in processing. So I can agree with this because a lot of times it, like on day shift and night shift or mid shift or whatever shift you work, it just feel like it's never enough people. Granted, it may be enough like when everybody is there and we're fully staffed, but when somebody calls out, it's crazy. It's hectic. It seems like you're doing 1,000,001 jobs, but you're getting the same pay. So I would say that in the sterile processing department, the staffing issues is mostly always an issue. Mostly always an issue. The second thing is lack of standardization. And that goes for like your department. You don't have the proper management. You're not following the IFU correctly, which I have mentioned before. The IFU is the instruction for use. So if you're just cleaning instruments and you have no knowledge of how it's supposed to be cleaned, that in turn can create increase in infections. And y'all, I'm gonna read a little bit from here. It will cause your SPD department to be, well, your sterile processing department to be disorganized. It's easier for you to make mistakes because you're not following the IFU. And you're just doing whatever you want. You have no structure. I have worked in a facility where there was no structure. So people was doing what they want, processing things how they want, and y'all, that is not the way to go. Standardized instructions and processes help reduce the risk of making costly errors and helps to keep team members accountable. And in order for us to keep like people accountable, that's why everything is traced in sterile processing. From when it comes to decon, when it goes to the prep and pack side, and when you put it in the sterilizer, everything is being tracked. Everything that you do, if you're in decon and you scanned it in, is tracking then. If you are on the prep and pack side and you assemble that tray, the tracking begins there. So this is kind of like how people are being held accountable. All right, the third thing, outdated or inadequate equipment. You will see it. Don't be ergonomics. If you see something that needs to be fixed or you can't work like that, say something to your manager, your supervisor. You should not be adapting to bad working conditions, okay? So this can be older equipment, inadequate sterilization technology. So if you know that the IFU said you need to put it in the Sterile machine and y'all don't have a Sterile machine, it's not getting properly sterilized. Additionally, not having enough equipment to meet demands is an equally devastating problem, which is true, y'all. If you don't have the equipment, you having all these cases and you only got one sterilizer, it's not gonna work. So that can also be an issue in the sterile processing department as well. What if a sterilizer, you got 2 sterilizers that's down, that's broke? That is going to affect the workflow of sterile processing. Okay, y'all, I had to come back because my camera is doing like something weird. Like it was blurry. I don't know if it's trying to focus. Yeah, that was weird. But that can be an issue in the sterile processing department. Just not having the inadequate equipment for you to run the day. For the day to go smoothly. Making sure that the surgeries and all that is up to date. And you have all your equipment for those surgeries. Let's see. That was number 3. So number 4, y'all, is maintaining integrity of sterilized items. Now, and I'm gonna read a little bit of it, and then I'm gonna emphasize on it. So once surgical instruments go through the sterilization process, it's crucial that they remain sterile before reuse. It is crucial that they remain sterile before reuse. Many SPDs have digital instrument tracking system in place to ensure control over their inventory. However, for SPDs that keep track of their sterilized stock on paper, the opportunity for human error increases. So that's like if you're at an older facility and they don't have sensor track and you're writing everything. We're human. You can make errors if you're not tracking it in a computer system. Yeah, and then a lot of times too, y'all, I have seen at facilities, normally if you have a tray and the lock on it breaks off. Some facilities have pre-cooked. I shouldn't be saying this, y'all, but some departments have pre-cooked locks that they put on if a lock or something pop open. So if you see it, y'all, don't do it. Don't be involved in it. All right, number 5, insufficient space or storage resources. This is an issue, and it was an issue at my last place, cause we would store loaner trays, and we really didn't have a lot of space for our loaner trays. So we would have our loaner trays, we would have our house trays, and y'all, you already know you don't supposed to be stacking your wrapped items on top of each other, but I have seen at facilities it's 2 and 3 trays stacked on top of each other. So just not having the proper storage is an issue and is a challenge as well. All right, number 6, difficulty meeting regulatory standards. So that's whether due to agent sterilization infractions, staffing shortages, or a lack of training. Can't stress this enough. Sometimes in the sterile processing department, you are not getting the proper training. And I'm going to say it, and I'm going to be honest with y'all. You are not getting the proper training that you're supposed to get. And you will get in trouble whenever something is wrong. But guess what? You wasn't trained properly. If you are ever in that situation, y'all let them know I wasn't trained properly. Can we go back to square one? I've been in that situation to where I'm new into the field. People train you. You're with a whole bunch of different people and you're getting trained and you're getting taught different ways and different things. So just the lack of training itself, I have experienced. Yeah, some SPDs struggle to comply with industry regulations. Falling short of these standards carries serious consequences for healthcare facilities and can lead to loss of accreditation or healthy penalties and fines. So I just don't understand how we have inspections coming, like we have Joint Commission, we have Amy coming in, and it seemed like at the last minute, that's when they're trying to train people. But we should be trained from the beginning. My last facility, it took me almost 2 years to get the proper training that I needed. I learned as I went. And I'm glad that now that I know better, I can apply that at my new job. I can apply those skills and that knowledge that I have now. Like if you coming in, you don't know. Because if you're not getting trained properly, you don't know. Like I like a facility that's by the book. Like my job now, they strict, but they are by the book. That is the way that you want to go. You may think like if you get into a hospital, like, oh, they're nitpicking, they're doing this. That's what you want. You want somebody who's going to train you. If they see you doing wrong, they're going to address the issue. That is what you want in the sterile process department. Because it's so many people out here that's doing what they want. You might see little Johnny doing one thing. Uncle Neek Neek doing a whole different thing. It should be everybody is on the same page doing the same thing in unison. It's hard to find sterile processing departments like that, but when you do find one, y'all, it's a plus. All right, number 7, quality management issues. While quality management issue systems are prevalent in healthcare facilities, and this is like QA, quality assurance, pretty much that's just going over the standards, making sure that you guys are meeting those expectations. If something is out of compliance, they're checking all that. Most departments don't have quality assurance. So the mistakes is greater. The infections may be greater. But I'm going to read a little bit. In a department where attention to detail is so crucial, it is important to foster a culture where quality is front and center. Yeah, in this department, you have to be attentive to detail. So like me, everybody make mistakes regardless. You're going to make mistakes. We're human, you're going to make mistakes. But sometimes it's better for a second or third eye to look and see, to look over your work, look over your trays. That's why, like with my job now, we have somebody who do second checks, which I feel like it's good because sometimes that first person misses it, and then if you have a second check, they're gonna catch it for you. So, number 7. Now we're going on to number 8. Lack of interdepartmental communication. So this is, again, the biggest challenge. In my last hospital, this was the ultimate biggest challenge. The communication between the OR and sterile processing. The OR always feel like it's sterile processing fault. I don't care what hospital you go to. I feel like it will always be that. Now, granted, at my hospital now, it's not like that. We don't really interact with a lot of nurses. But anytime you're at a facility where you interact with a lot of nurses, I just feel like they always blame SPD. And I have heard it from several people that I have worked at different hospitals. Y'all, they all say the same thing. It's always SPD fault. Yeah, so just that open communication is crucial to maintaining patient safety. Poor relationships between two departments can not only impact patient outcomes, but result in a compromised quality of care and lead to decreased productivity as well. So y'all, that is true. So number 9, our last and our final one. Inadequate resources. Whether it is because of a shortage in reliable equipment, staffing, or funding, SPDs suffer when asked to operate using limited resources. Y'all, so limited resources could be my pay. If you want me to do all this work and you not paying me the money that I feel like I can be compensated, that's inadequate resources, okay? Because y'all adding on a whole bunch of work, but we can't get raises. That is the inadequate resource, okay? I don't have that issue with my job now, but yeah, inadequate resources, okay? Because it's like y'all hiring these people, y'all adding on all this work. Where is the funding for the budget to pay y'all workers? What else? Increasing sterilization teams are asked to do more with less. Y'all, I just said that. Sterilization teams are asked to do more with less, which can lead to errors as a result of cutting corners. That goes for the money. That goes for if equipment go down. So I have had this issue before. So we have a cart wash, right? Now the cart washer, after you offload everything out the cart washer, you send it through to get washed. Sometimes that have been down, y'all. So guess who gotta wipe down them carts? The sterile processing tech. And I always said, like, if that cart washer is down, we need to get critical incentive pay or something, because we doing a cart washer job. And if you work in sterile processing, then you know, bending down, scooping, and all that after you already doing all that work in sterile process in decontamination can be a lot. Yeah, y'all, that's pretty much it for my top 9 challenges in sterile processing. I actually got this off Consolidated Sterilizer System webpage. But y'all, that's it. That is it. That is all. Like I said, you guys, if you haven't already, go ahead and subscribe to my channel and hit that notification bell so you can be alerted the next time I upload a video. And y'all, just comment what state you are in. Comment if you're in school. Comment if you're thinking about getting into the sterile processing field. Y'all, I love the feedback. Just let me know. And as always, be blessed, be kind. Peace out. Breathe the Diva is signing out. Bye.